Welcome to every viewers of EquiDH TV. As you can see, we are currently at Urology and Urology Center Facility, a building that is to be commissioned by the President of Ghana, His Excellency Addo. So this is the building is about to commission for Korle Teaching Hospital, newly built building. Very soon we'll go inside and see the nice equipment there, how inside looks very nice. So currently we are waiting for His Excellency to be here. As you can see, the nurses, the doctors, everyone is ready. Yeah. Very soon the president will be joining us. Thank you.
Excellency President Addo, Ministers of State, my Deputy Minister, Honorable Peku Ajipaminu, former Minister of Health, the Presidential Advisor on Health, Board Chairman of the Korle Teaching Hospital, Project Developers, Mrs. Vamed, Director General, Ghana Health Service, all heads of agencies who are here, the parliamentary candidate for the new patriotic party in the Ablekuma South constituency, Honorable Samuel Sabalati, aka Teacher Addo, the PC from Ablekuma Central, the the New Patriotic Party, Honorable Jefferson Saki, board member of the Korle Teaching Hospital, former PC for Ablekuma South, now PC for Weja, Korle Constituency, Honorable Jerry Ahmed Shai, CEO of the Korle Teaching Hospital, head of the Urology, Professor J.E. Mensah, Nime, Name, our cherished staff of the Korle Teaching Hospital, ladies and gentlemen, all protocol observed. I am very excited to be here this morning with a visionary leader in the person of Nana Addo Akufo-Addo. I am very happy because today, again, we see evidence of this government's commitment to healthcare delivery. Not only in healthcare, but in other sectors as well. Today, we are here to see for ourselves evidence of the President's commitment, not with words, but by deeds. So much has been invested in healthcare in the past 7.5 years. Approximately $2 billion has been sunk into the healthcare sector. I only like to bother you with a list of all the projects. It might take some time before we leave. But it is important to mention that the abandoned maternity and child block at the Kofoanoche Teaching Hospital, which was started by a champion over 40 years ago, has been brought down and restarted anew by President Nana Addo Akufo-Addo at the cost of 138.5 million euros. It is refreshing to note that the Eastern region is now getting a befitting fit-for-purpose regional hospital at the cost of $70 million. You see this structure on your way to Suhum from Koforia. It is also important to note that when you go to Kwanta, you have a $90 million project going up to give them a new regional hospital. Very bearing of this president, he didn't only stop at Kwanta, he's also building one at Apibeni at the cost of $95 million. Your Excellency, this Urology and Nephrology Center started not as a government project, but as a private project in partnership with Korle Teaching Hospital. Your Excellency, in 2018, I was then a member of parliament for the good people of the Chukuku, and you made me the board chairman for the Korle Teaching Hospital. So I had the privilege to assess the then arrangement. Professor Mensah kept on saying that we will not turn away any Ghanaian from this place. He repeated it over 7 times. And I think many of you don't understand or might not know the background why he kept on using that phrase. This project was going to be a private arrangement. More or less, in plain words, it was going to be owned by a private person. And so it would have provided physical access. But before you enter, financially, the access was not guaranteed. And so many Ghanaians would have been turned away if you are not intervening for it to be a government-funded project at the cost of 38 million euros. So, Mr. President, I am particularly happy because the ordinary Ghanaian, especially the men who are 40 years and above, and who previously had to wait sometimes for 2 years before they get surgical intervention to be able to be the men that they are. This time, the story is changing right here at the Korle Teaching Hospital. Your Excellency, in order to ensure that 5 generations from now would come and benefit from this facility, we are going to use this facility as a pilot so that that impression that some people have that when it is for government, it's for nobody, should come to an end. This facility will be run with an MOU from the Ministry of Health, where the reports from Korle as well as that of the contractor in terms of maintenance, it is performance of that report that will guarantee continued leadership and the position for those who are heading the facility. Your position is guaranteed as long as we are maintaining the facility. That is the new arrangement we are going to have. And then we say that in the next government, all heads of facilities would keep their positions only when they keep their performance above a particular threshold. Your Excellency, it is clear that you intend to build. Your Excellency, it is abundantly clear that you intend to build this country town by town, constituency by constituency, hamlet by hamlet. And I am happy that a vendor who is not a Ghanaian has testified, I'm talking about Mohammed, that everywhere you go in this country, they have put up a health facility in this country. Your Excellency, this facility is no ordinary facility. This Urology and Nephrology Center of Excellence will provide a 30-suite dialysis station for kidney disorders, referring to end-stage kidney disease, a 70-bed for genitourinary patients, outpatient departments, and a diagnostic center. And let me say it here, when we talk about transformational leadership, what it means. Before, Your Excellency, you started your tenure as President of the Republic, all the dialysis stations or beds we had in Greater Accra put together, not in Korle, in Greater Accra, were not up to 30. And so this facility alone is going to match all dialysis beds we had prior to 2017 when you were sworn in. That is transformational indeed. As I mentioned earlier, there are three kinds of access in healthcare delivery. Physical access, which is the building, and the beds, and the machines, and the theaters. That has been made possible by this government. There is the other access, which is the financial access. Those coming for dialysis, what was the story before this government came? From President Korle's time to now, if you have end-stage kidney disease, you have to pay for dialysis from your pocket. That has been our story. But today, under the leadership of President Korle, if you are 60 years and above, your dialysis sessions are paid for by government through the National Health Insurance Scheme. If you are 18 years and below, that is children, all your sessions are paid for by government through the National Health Insurance Scheme. This is what we call financial access. It means with your 8 Ghana cedi renewal of your health insurance for a year, you can have all the sessions that you need. Money is no more a barrier. For those 18 years to 60 years, after all your appeals, the President of the Republic has given any chance to go ahead to pay for 2 sessions out of the average 4 that you receive every week. I am confident that it is possible to pay for all dialysis sessions. And if you all support us to continue governance, I would convince Dr. Baumia to pay for the rest of the sessions. Professor Mensah, head of urology, touched on the third kind of access, which is the professional access. If you come to the unit with the buildings and nice theatres, with financial access guaranteed, are you going to meet those who have the skill and capacity? That is where training comes in. And I'm happy to mention that under President Akufo-Addo, this government pays for training of specialists at the Ghana College of Physicians and Surgeons. This government pays. And as CEO, then CEO, I signed a check to the college to pay for trainees to make sure that we get enough specialists to guarantee professional access as well. We believe everything is possible. It is possible. And so we have not even stopped at dialysis sessions. His Excellency President Akufo-Addo, when he commissioned a new block for the psychology and psychiatry department, announced in Korle here that very soon this government will pay for mental disorders as well through the national health insurance. And I'm happy to mention that depression, bipolar disorders, schizophrenia and anxiety now since last week are now all paid for through the national health insurance. Ladies and gentlemen, we are at the Korle Teaching Hospital. I am at the Ministry of Health. The next project in line from President Akufo-Addo's table from Korle is the new maternity and child block that is coming up at the cost of $140 million. And so, for staff of Korle, for Ghanaians here in Addo South and beyond, remember that you have a project in your office. That project is possible. And I can speak with confidence that when you help for Dr. Maumia to continue, that project is possible and will happen. This is my prayer that we will have a new obstetric and gynae block. Looking at what this government has done, don't ever think it is impossible. We can do it. The momentum with which we are doing this project can be continued with a continuation of the tradition that is incumbent. Any other step can threaten and jeopardize the momentum. And so with this prayer of continuity, I would like to thank all those who have made this project possible. From our father and visionary leader, President Addo to my former boss, I always call him a boss, Honorable Peku Ajamenu, to the heads and board of Korle Teaching Hospital, Professor J.A. Mensah for all the pushing, your beautiful nurses, staff of Korle, Famed, all those who are the best of the journey. We are proving at Korle that when you push and believe, it is possible. Let's continue to believe that it is possible. God bless Korle. God bless our father, President Akufo-Addo. God bless our member and the British School. Thank you very much. Thank you very much.
Thank you very much. Everything is possible. Addo, the President of the Republic of Ghana. Please, let's rise to our feet as we welcome him to give his speech. Thank you very much. You can now resume your seat.
Eminent clergy, Minister for Health, his predecessor, the former minister, a member of parliament from Doman Central, the deputy minister for health, a member of parliament from Suta, Director General, Presidential Advisor on the Health, Director General of the Ghana Health Service, the Chairman and members of the board, and the Acting Chief Executive Officer of the Korle Teaching Hospital, the Director of VAMED, the representatives of the project developers, distinguished doctors, MPP parliamentary candidates, men, non-men, and other traditional rulers, fellow Ghanaians, ladies and gentlemen. I'm very happy to be here today to inaugurate the state-of-the-art Urology and Nephrology Center of Excellence at Korle Teaching Hospital. This landmark project represents a considerable milestone in our nation's journey toward transforming healthcare and providing advanced medical care for those battling urological and nephrological conditions. It symbolizes a lifeline for many Ghanaians in need of these critical services. Korle Teaching Hospital has long been the primary referral center for urology and nephrology in the country. Recognizing gaps in both primary and tertiary healthcare services across public and private sectors, particularly in urology and nephrology, government identified the need for intervention. In 2011, as part of efforts to address these challenges, the Ministry of Health and Korle received an unsolicited proposal from VAMED Engineering to establish a urology center of excellence through a public-private partnership. In 2013, Korle expanded the scope to include nephrology, recognizing its connection to related medical conditions. Unfortunately, the initial PPP financing arrangement could not materialize. However, in our relentless pursuit to address this urgent healthcare gap, a new financing agreement was secured with a credit facility of some 38 million euros from Raiffeisen Bank International of Austria and insurance cover provided by OEKB Group. Today, we witness the realization of that vision, a testament to our government's unwavering commitment to improving healthcare in Ghana. The facility we're commissioning today comprises a 30-suite dialysis station for patients with kidney disorders, a 70-bed unit for genitourinary patients, an outpatient department, comprehensive diagnostic and treatment services, inpatient care, administrative and management offices, public amenities and staff facilities, medical and non-medical support services, a research facility, and a post-construction maintenance and training program lasting 3 years. It is important to emphasize that the credit facility used for the construction of this hospital will be repaid by government. I therefore call on all the community and all Ghanaians to hold the healthcare managers accountable for the proper utilization and timely maintenance of this facility to ensure its longevity and sustainability of its services. Community involvement and support are crucial to this effort. The project also includes a comprehensive 2-year post-completion maintenance and training program. I encourage strongly the management of Korle Teaching Hospital to work closely with the contractor's maintenance team to ensure that the facility remains in optimal condition. The contractor, Messieurs Varmin Engineering, along with their technical consultants from Ghana, have delivered exceptional work, and I extend my sincere gratitude to all the project contributors for their dedication. This modern facility is fully equipped with cutting-edge medical technology and staffed by well-trained healthcare professionals. It will provide advanced treatments for patients with chronic and acute kidney failures, as well as other urological conditions. The center is also positioned to offer life-saving services such as kidney transplants, helping to fulfill our national objective of achieving universal health coverage. The establishment of this center of excellence is a game changer, especially for men above the age of 40, like myself, who are particularly vulnerable to neurological conditions. Moreover, the center will put Ghana on the map for medical tourism, providing services to patients from neighboring countries and beyond. This will generate additional revenue for the facility, ensuring sustainability and continued expansion of services. Ladies and gentlemen, in August of this year, I had the privilege of commissioning the Bogatanga Regional Hospital in the Upper East region. By the close of 2024, we expect the completion of several key healthcare projects, including the construction of 11 district hospitals and 1 polyclinic in the Ashanti, Eastern, Greater Accra, and Ahafo regions. At the following locations: Jumapo, Kwabeng, Ikwatia, Adukro, Achiase, Swami, Robonso, Sabrulun, Manso Kwanta, Kadir, Nim, and Bunkatananso, among others. These projects will represent the fulfillment of the Kufuor government's commitment to achieving universal health coverage and ensuring the delivery of more efficient healthcare services across the country. Additionally, you will recall my government's flagship Agenda 111 initiative, which seeks to build district hospitals in every district without fail, and fully functional regional hospitals in each regional capital, particularly in the newly created regions. This initiative, under the supervision of the Office of the Chief of Staff and the Office of the President, continues to make impressive progress. The program was revised further to include facilities such as the Accra Psychiatric Hospital and district hospitals at Karaka, Meshia, and Nkranzamo. To facilitate effective monitoring and supervision, the project has been categorized into 8 zones, with 98 active district hospital sites and 2 psychiatric hospitals where contractors are on the ground and work is well underway. Of these, 8 of the district hospitals under construction are nearly completed, with the overall progress of the entire Agenda 111 project standing at 69% as of September 2024. Several sites, currently at over 90% completion, are expected to be finished within this year. Challenges encountered at 16 other sites have been addressed through re-engineering and relocation. Construction has now commenced. Work on 2 regional psychiatric hospitals in Kumasi and Tamale is also progressing actively. The Kufuor government remains steadfast in addressing the uneven distribution of healthcare workers, particularly in rural and underserved areas. I urge the Ministry of Health to expedite the completion of the draft incentive package for government consideration, ensuring that healthcare staff are placed where they are most needed. Fellow Ghanaians, our healthcare infrastructure stands as one of the greatest legacies of my administration. Established largely under the supervision of the former long-serving Minister for Health and the Member of Parliament for Bama Central, the Honorable Kwaku Ajiman, to whom we all owe so much. To sustain the progress we have made, it is critical that we implement a well-thought-out maintenance plan. I call on the management of the Urology and Nephrology Center of Excellence to adopt a robust preventative maintenance strategy to ensure the longevity and effectiveness of this facility. Allow me to highlight some of the remarkable achievements of this administration in the healthcare sector. From 2017 to August this year, we've added some 8,665 hospital beds for admission, i.e., from 24,153 hospital beds in 2016 to 32,818 hospital beds by August 2024, representing a rise of some 36%, further underscoring our commitment to expanding healthcare infrastructure. This excludes the total number of beds to be provided by the Agenda 111 project. We've also made significant strides in reducing maternal, adolescent, and child mortality rates. The institutional maternal mortality ratio, IMMR, has declined steadily from 127.3 deaths per 100 live births in 2018 to 102.1 per 100 live births in recent years. Furthermore, improvements have been recorded in reducing neonatal, infant, and under 5 mortality rates. Despite these gains, challenges remain, particularly in ensuring equitable access to healthcare services for children across the country. These achievements reflect our dedication to improving healthcare services and advancing towards the attainment of the Sustainable Development Goals, particularly our targets of reducing maternal mortality to 70 per 100,000 live births and under 5 mortality to 12 per 1,000 live births by 2030. Fellow Ghanaians, in conclusion, I reaffirm my government's unwavering commitment to delivering on our promises. I extend my sincere gratitude to the financiers, the Raiffeisen Bank, International AG of Austria, the new AJB Group, the contractor, Messrs. Vamed Engineering, consultants, Messrs. K and Partners, the Ministry of Health, the Ministry of Finance, the management of Korle Teaching Hospital, traditional leaders, international partners, and all stakeholders who have contributed to the successful completion of this Urology and Nephrology Center of Excellence at Korle. Accordingly, Amen, ladies and gentlemen, it is my singular honor and pleasure to declare the Urology and Nephrology Center of Excellence at Korle Teaching Hospital duly commissioned. May God bless the center and us all and our homeland Ghana and make her great and strong. I thank you for your attention.
Thank you very much. Let's give our president a standing ovation and acknowledge him for what he has done. Thank you so much. Thank you so much. Thank you so much. Yes, let's see the president of Ghana. Please, you may take a seat. Let's have them roll. Have the whole of